We turn our attention now to the intersection of health and poverty, and the disparity in health outcomes between richer, whiter zip codes and poorer, browner ones. One of the biggest health concerns for those poor neighborhoods is lead poisoning of children. Rick Jackson spoke with the Reverend Derek Wade, who lost his son Demetrius to lead poisoning. Demetrius was diagnosed at 12 in 1992 and died at 24. Reverend Wade says the city isn't doing enough to keep people safe, but that doesn't mean that he's lost hope.
And I believe that we have made more progress in the last 3 or 4 years than at any time in the last 30 years. So you don't want to get frustrated. You just keep raising the awareness for the public and for the parents and the children, and eventually it'll resonate with them how serious and how urgent the lead issue is.
Although we don't know which of these two gentlemen it is yet, one of them that you're speaking to right now is going to be our mayor. Is this one of his first issues that you want him to tackle?
Yes, it is. Most definitely. Cleveland is one of the worst lead contaminated cities in the United States. Recently, they talk about and bring up the water crisis and the lead crisis in Flint. And we know that it is 3 times more damaging here because of the housing stock that has been built before 1978.
The city recently began to implement the lead-safe housing law that was passed in recent years, but there is a lot more work left to do. For our candidates, what can the city do to speed up the process of ensuring that our rentals are safe from lead paint and to make sure that landlords comply with the rules? Mr. Bibb, we'll begin with you.
You know, I had the great fortune to meet Derek Wade on Saturday, and his story just broke my heart. And it's a shame that it took a citizen-led effort to finally get action on this issue in the city of Cleveland. As Yvanka Hall has said, the lead paint crisis in our city is public enemy number 1, and we need more urgent leadership on this issue now more than ever. That's why, if elected mayor, I intend to make sure we beef up our code enforcement within our building and housing department to make sure we can beef up enforcement and abate these homes that have been plagued with lead paint. I also intend to appoint a lead czar at my administration to work across all of our departments to ensure we can eradicate this issue long term. And then as mayor, I would use a portion of the American Rescue Plan dollars, as Councilman McCormick and Spencer have advocated for, to make sure we can fully fund an endowment to eradicate this crisis in Cleveland once and for all.
Thank you, Council President Kelley.
Thank you. The lead crisis in the city of Cleveland is tragic. It's unacceptable, and we need to create a lead-safe Cleveland. The challenges that we have to deal with, we have to work through, is really one of workforce. The number of certified lead inspectors in the city of Cleveland. We need to do a better job training and getting people ready. We need to make sure that we have the personnel within City Hall to really do it. You can't just beef something up, because the requirements to be a building inspector aren't that, it's not a resume position. There's other qualifications that you need to have, and it's hard to find those people. So we're slowed down by workforce a little bit. But again, we can't use any of those excuses. We have to make sure that creating a lead-safe Cleveland is priority number 1. Yes, we were slowed down by COVID because the inspectors couldn't go in the houses during this time, but we have to get back on. We have improved the rental registration, and we just cannot rest until we have a true lead-safe Cleveland.
Thank you very much. Mr. Bibb, rebuttal you wanted to offer?
I would just say this is a part of politics in Cleveland that frustrates me, and why I believe our campaign has resonated with folks all across our city. We can't be afraid to try hard things. There's always an excuse. Oh, this is this hard. It's hard to hire, and so we just give up. People want change. We've had 16 years of the failed status quo, and on this issue, we need urgent leadership to try hard things.
Mr. Kelley?
Thank you. It's easy to be for things. It's easy to be against, and nobody's saying because it's hard, we're not going to do it. Getting the rental registration up to a point where it was workable was not easy. It was hard, and we did it. making sure that we have enough staff to get into houses. It was hard. It took a long time, but we did it. What's frustrating about politics should be that it's too easy to say something on a campaign trail without delivering, without a plan to actually deliver it. There is nothing that I will say during this campaign that I don't intend to do as mayor or can do. But again, we have to move away from words and look at actions.
Our next question comes from Lawrence.
Cleveland's Department of Public Health has struggled for years with leadership turnover, loss of grant dollars, workplace discrimination, and difficulty dealing with pressing public health issues like lead poisoning, as we've been discussing. How would your administration run this department differently?
Council President Kelley.
Thank you. So the Department of Health is something that is public health is one of those just fundamental bread and butter municipal issues that has been part of city government for as long as there's been city government. We really need to look at the crisis that we have in front of us right now is COVID. We need to make sure the health department's first priority is going to be getting all of our citizens vaccinated, and it's going to be done doing so with a hyper-local perspective in terms of making sure that we're reaching out to where people are in churches and libraries and rec centers and making sure that gets done. We also need to continue to work with the state of Ohio. We need all those grant funders that deal with Division of Air Quality. Our air quality right now is something that we need to begin working on right away. And that gets to our tree canopy. We need to make sure that the tree canopy is part of our air quality plan. But the Department of Health just it's got to start at the top. There's got to be leadership that's going to make sure that we have public health as our first focus.
Thank you, Mr. Bibb.
Well, this pandemic truly exposed how inept we've been managing our public health department year after year after year. Right now, the public health department receives less than 2% of the entire city's budget. And even during this pandemic, we didn't have one epidemiologist employed in our department. And all across the city, even internal City Hall employees didn't even know how to get their shot and get vaccinated. And we need not only urgent leadership on this issue, but a mayor that's willing to think outside the box. I intend to explore a partnership with our county public health department to make sure that we can fully support public health in our city. Better partnerships with UH, Cleveland Clinic, and Metro Health to not only address some of the disparities we see in our community, but from a public health policy perspective, where should Cleveland be going in the future? Now is the time for action on this issue. We cannot afford more of the same.
Thank you. And Council President Kelley, would you like to respond?
Just that the Department of Health is a critical function for the city of Cleveland. And my opponent has thrown this 2% thing out on more times than I can remember. But it's just not true unless you don't take into consideration all of the dollars that come. For example, the state of Ohio, we're their agent for the Ohio EPA in terms of air quality. There's a whole lot more money that comes in than just what is transferred from the general fund.
Mr. Bibb, would you like to respond?
I'm good.
All right, we'll move on to our next question from Elizabeth McIntyre.
Thank you, Nick. The neighborhoods around our major healthcare systems are suffering from decades of disinvestment, poverty, and poor health. What will your administration do to improve population health in Cleveland and to lift the fortunes of people who live not only in the shadows of these anchor institutions, but beyond them?
Mr. Bibb.
This issue is important. We tout the fact that we are a healthcare mecca across this country, but in Huff, in Central, on Cedar, many of our residents have some of the worst health disparities that will rival, in many cases, third world countries. As mayor, I'm going to take this issue head on. We got to do a better job of making sure that residents in these neighborhoods have access to jobs in these institutions, but also that they have good access to quality healthcare services in this community. And we need to do a better job of examining these charity care investment dollars to ensure we're actually seeing real investment in these neighborhoods. And it's going to take a mayor that can truly bring these institutions together to get more accountability on this issue long term, I believe.
Thank you. Mr. Kelley.
Thank you. Indeed, we cannot be the healthcare capital of the world if the neighborhoods surrounding these great institutions are in poverty. That's why I'm happy to have worked with my colleague Bashir Jones to make sure in just the 4 years that we've been working together that over $500 million has been invested in Huff for development and in parks and in public improvements. Working with my colleague Kevin Conwell to make sure that projects like the Glen Village project project come to fruition. It's showing people that investment works in all our neighborhoods, which is going to be critical for the next mayor. But we also have to have a different approach to public health, just like we do in Old Brooklyn. We need to start with a neighborhood health assessment, and we need to start doing a better assessment over not who has access to health care or doctors or when's your doctor's appointment. We need to start asking questions like, do you live within a 10-minute walk of a park? Do you have access to fresh food? Do you feel safe in your home? Do you have a job? Do you know your neighbors to the left and the right? Is there a school in your neighborhood that you can send your kids to? That's how we really get to neighborhood health equity and quality health in our neighborhoods.
Thank you very much. I want to move to one more question on this topic, and that is COVID-19 vaccinations. According to the Cleveland Department of Public Health, at last check, just shy of 40% of Cleveland residents are fully vaccinated against COVID-19. What should the city be doing to get more people vaccinated and protected from the virus right now? Mr. Kelley.
Thank you. Right now, today, we need to make sure that we are getting to where the people are. We need to make sure we are vaccinating people in churches and libraries and rec centers. We have to set up, we set up the Wolstein Center, which was in many ways very well executed and people had a good experience, but people just weren't going down to the Wolstein Center to get their shot. I was knocking on doors and I ran into an elderly woman answer the door, and she told me she hasn't gotten her shot yet because she was waiting for somebody to come and tell her, how to get and where to go. That can't be our approach. We have to make sure that we are reaching out. Vaccination is the one thing, it's the one weapon we have against this that we know works, that improves public health. We have to make sure that vaccinations and vaccines are available to people where they are. Our health department needs to be a partner in that, but that's got to be something that we should start tomorrow.
Thank you. Mr. Bibb.
We got to go on the offensive on this issue. The mayor's office matters when it comes to raising public awareness about why it's important to get vaccinated. You talked about the 40% vaccination number. That's even worse in communities of color all across the city. As mayor, I would be knocking on doors myself, talking about why we should trust the science, talking about the importance of getting vaccinated, because we can't get our economy moving again until everybody in the city gets vaccinated and that we're back to safety all across our city. The mayor's office should matter when it comes to this.
Thank you very much.